Imagine a major highway with cars speeding along. Now, picture a crack appearing in the road's foundation. This crack widens, threatening the highway's integrity. This is a simplified way to think about aortic dissection, a serious condition affecting the aorta, the largest blood vessel in our body. The aorta acts like this vital highway, carrying oxygen-rich blood from the heart to the rest of the body. In aortic dissection, a tear develops in the inner layer of the aorta's wall. This tear allows blood to flow between the layers, further weakening the aorta and potentially leading to a life-threatening rupture. Aortic dissection is often a silent threat, developing gradually without any noticeable symptoms. However, when symptoms do occur, they can be mistaken for other conditions, making diagnosis challenging. Understanding the causes, types, and treatment options for aortic dissection is crucial for early detection and effective management. Multiple factors can contribute to the development of aortic dissection, some within our control and others not. High blood pressure or hypertension remains the most significant risk factor. Consistently elevated blood pressure puts excessive strain on the aorta's walls, increasing the likelihood of a tear. Connective tissue disorders such as Marfan syndrome and Ehlers-Danlos syndrome weaken the structural integrity of the aorta, making it more susceptible to dissection. Age plays a role, with the risk increasing after age 40 and peaking between 60 and 80. Trauma, such as a car accident or a fall, can also cause direct damage to the aorta, leading to dissection. Certain lifestyle factors contribute to the development of aortic dissection. Smoking damages blood vessels, including the aorta, making them more prone to tearing. Cocaine use causes sudden spikes in blood pressure, putting immense stress on the aorta. While some risk factors are unavoidable, managing controllable factors like blood pressure and avoiding smoking can significantly reduce the risk of aortic dissection. Aortic dissections are classified into two main types, type A and type B, based on the location of the tear. Type A dissection affects the ascending aorta, the portion closest to the heart, and potentially the aortic arch, which branches into blood vessels supplying the head and arms. Type A dissections are more common and generally considered more dangerous. Type B dissections involve the descending aorta, the portion that runs down through the chest and abdomen. While generally less life-threatening than type A, type B dissections can still lead to serious complications. Both types share similar risk factors but present unique challenges in diagnosis and treatment. Complications from aortic dissection can be severe. The dissection can extend further along the aorta, blocking blood flow to vital organs like the brain, kidneys, or intestines. A rupture in the aorta, often a catastrophic event, can lead to massive internal bleeding. Understanding the distinctions between type A and type B dissections is crucial for determining the most appropriate and timely medical intervention. Recognizing the symptoms of an aortic dissection can be life-saving. The onset of symptoms is usually sudden and severe, often described as a tearing or ripping pain in the chest or back. This pain can migrate as the dissection progresses, moving to the abdomen or legs. Other symptoms may include shortness of breath, fainting, sweating, and symptoms similar to those of a stroke, such as sudden difficulty speaking or a loss of vision. These signs can easily be mistaken for other conditions, making it crucial for anyone experiencing such symptoms to seek immediate medical attention. Rapid diagnosis and intervention are key to improving survival rates. Understanding these symptoms and acting quickly can significantly impact the outcome of an aortic dissection. Treating aortic dissection typically involves a two-pronged approach: medical management and, in many cases, surgical intervention. Medical management aims to stabilize the patient's condition, control blood pressure, and prevent further tearing of the aorta. Medications are used to lower blood pressure and slow the heart rate, reducing the stress on the weakened aorta. Surgical intervention often becomes necessary, especially for type A dissections. The most common surgical procedure involves replacing the damaged section of the aorta with a synthetic graft, a durable tube that restores normal blood flow. In some cases, surgeons may repair the tear in the aorta's wall instead of replacing the entire section. The choice between medical management and surgery depends on several factors, including the type and location of the dissection, the patient's overall health, and the expertise of the medical team. Early diagnosis and prompt treatment are essential for improving outcomes in aortic dissection. With the right approach, many patients can achieve positive outcomes and return to their normal lives.